beyond the new normal. Why pelvic floor physical therapy is essential for pregnancy and postpartum care for many women. Pelvic floor issues are treated as an inevitable part of motherhood, lumped into the same category as stretch marks or swollen ankles. We are often told to just deal with it, as if urinary leakage or pelvic pain are simply the price of admission for bringing a child into the world. However, medical experts and patients alike are beginning to challenge this narrative. The reality is that the pelvic floor, the complex web of muscles and ligaments supporting your bladder, bowel, and uterus, undergoes an intense physical ultramarathon during pregnancy and childbirth. The invisible strain, what happens to your body? The pelvic floor is responsible for much more than just holding things in. It manages continence, supports internal organs against gravity, and plays a vital role in sexual function. During pregnancy, several factors converge to stress these muscles. Physical weight. As the baby grows, the uterus expands into the abdominal wall, shifting the body's center of gravity and placing immense pressure on the pelvic floor. Hormonal shifts. Hormones like relaxin and progesterone increase tissue flexibility to prepare for birth. While necessary, this can lead to instability or a feeling of heaviness. The mechanics of birth. Whether through vaginal delivery or a C-section, the pelvic floor must undergo extreme stretching and contraction. Even C-section patients face risks, as the months of pregnancy preceding the surgery have already strained the pelvic architecture. Most people don't think about their pelvic floor until it forces them to. Leakage, pain, pressure, those are usually the entry points. Carrie Pagliano, DPT, moving beyond the Kegel myth. A common misconception is that pelvic floor health is synonymous with doing Kegels. In reality, effective therapy is much more nuanced. Pelvic floor dysfunction generally falls into two categories: weakness or lack of coordination. If your muscles are already too tight, hypertonic, performing repetitive Kegels can actually worsen the problem by increasing tension. Pelvic floor physical therapy, PT, addresses the root cause by looking at the whole system, including muscle coordination, learning how to both contract and fully relax the muscles. Breathwork, using the diaphragm to manage intra-abdominal pressure. Surrounding support, strengthening the hips, glutes, and core to take the load off the pelvic floor. Nerve and tissue health, addressing pain and sensitivity through targeted movement. What to expect in a therapy session if you are considering pelvic floor PT. Knowing what happens behind closed doors can demystify the process. The initial assessment, the first session, is typically a conversation. Your therapist will discuss your medical history, symptoms such as pain during sex or bladder leakage, and lifestyle. They may also observe your posture, breathing, and functional movements, like sitting or standing, to check for muscle imbalances. Internal assessments, while not always part of the first visit, internal exams are a standard tool for specialists. Using lubricated gloves, a therapist may perform a gentle internal check to assess muscle strength and endurance, tissue healing and sensitivity, the ability to relax the pelvic floor under pressure. Note, consent is paramount. You always have the right to pause or stop an assessment at any time. Why early intervention matters. While many women seek help postpartum, there is significant value in starting therapy during pregnancy. Research indicates that pelvic floor training during pregnancy can reduce the risk of significant perineal tears during birth and decrease the likelihood of postpartum urinary incontinence. By training the muscles to coordinate, learning how to relax the pelvic floor, while engaging the core, women can better prepare for the intense physical demands of labor. The bottom line, pelvic floor dysfunction is not a mandatory side effect of motherhood. Through specialized physical therapy, many women can regain control, reduce pain, and significantly improve their quality of life both during and after pregnancy.